Western Oregon. This is NBC 16 News at 5:30.
Good evening and thank you for joining us for NBC 16 at 5:30. I'm Jacqueline Mazer. Coronavirus cases have increased to 1,183, including 33 deaths. Washington, Multnomah, and Marion counties alone have a majority of cases. Taking a look now at our region, Benton County stands at 21 cases. Linn County still has the most cases with 45. Here in Lane County, we now have 32 cases. The newest cases are a man in his 60s from Eugene Springfield who is currently being hospitalized, and a woman in her 50s also from the Eugene Springfield area. She is medically stable at home. Deschutes County, meantime, has 44 cases. There are 12 confirmed cases in Douglas County. No one has tested positive in Coos County. Taking a look at the bar graph on your screen now, showing the growth of positive coronavirus cases here in Oregon and how that number has grown in our state since March 10th. You can see there were just 19 positive cases statewide on that date, compared to 1,183 cases as of today, just under a month later. Well, Lane County health officials say more than 1,000 test results are with public health at this time. 6 patients remain in the hospital. 17 are recovering at home. Lane County now has 7 recovered COVID-19 patients.
Our definition of recovered is 72 hours after the fever has broke and after they have stopped coughing without the use of medication to facilitate that.
Health officials say they're preparing for the largest spike in cases over the next few weeks. So far, there has only been 1 death linked to COVID-19 in the county. Lane County Public Health is starting live stream briefings in Spanish. Spokesperson Jason Davis says this is their way of making sure they reach everyone. He says many people prefer to get information from someone speaking their own language. That's why Lane County Public Health teamed up with Centro Latino Americano to start weekly live briefings on their Facebook page. Lane County Public Health's Deputy Health Officer's first language is Spanish, so Davis says she's naturally a perfect fit. Dr. Lisandra Guzman will host the first conversation in Spanish, and depending on how it goes, there will be more conversations to come. The Facebook Live will start Wednesday at 1:30 p.m. on Centro Latino Americano's Facebook page. A Lane County building will now serve as a respite and recovery center for Lane County Public Health's coronavirus response. The building will be used for people waiting for coronavirus test results and for those who have tested positive. This space is for those who do not require hospitalization and do not have the resources to isolate themselves. Food and laundry services will also be available. The length of stay for each person will depend on their medical needs and conditions. The building was approved for purchase by the Lane County Board of Commissioners last week. Well, starting this Thursday, passengers on LTD buses will have to wear a face mask covering their mouth and nose to ride. This rule will also apply to all LTD employees, including bus drivers. LTD's Assistant General Manager Mark Johnson says any CDC-approved mask or bandana will be enough. LTD has limited their routes and the number of people allowed on their buses. They're encouraging passengers to only use the bus if absolutely necessary.
Maybe thinking, those are kind of extreme steps. Extreme steps are exactly what's going to keep us safe and keep this from spreading. So, we're happy to be taking the steps that we're taking to ensure that people stay healthy.
Johnson says people without a mask will not be permitted to ride LTD buses. There's no set date for when this rule will end. Johnson says they are following the lead of local and state health officials. Governor Gov Brown issued a statement on the CDC's new guidance regarding the use of masks in public, saying, quote, "Wearing homemade masks will only be effective if we all work together, continue to stay home to the maximum extent possible, and add wearing a homemade mask to the list of precautions you are practicing when you go out in public." Students at the Technical Science Wing of the University of Oregon are taking on the coronavirus by giving medical first responders the protection gear they need. NBC 16's Tom Adams tells us about a new project just underway at the Eugene campus.
That's how it looks in place.
Busy is an understatement for the U of O's Scientific Instrument Machine Shop. Students and managers have found a way to make a difference in the COVID-19 outbreak. The team is producing new, clear, and reusable face shields.
We've got about 300 out in the community now at local hospitals, and we have more requests coming in every day.
How did this all come about in the lab?
Yeah, that's a great question. There's a huge effort at the university to both respond at the U of O and in the community in response to COVID-19.
Face shields that cover the entire front and sides of the face are considered vital PPEs for medical first responders.
We quickly iterated over a course of 2 days with local doctors and nurses, let them try it out, made a few design changes.
U of O shop students are able to produce 100 shields each day.
The design we came up with, because of the equipment and the materials we have, we're able to offer a design that can be reused up to 30 times.
The design is pretty simple. Pieces of polycarbonate are cut into shape using a water jet cutter with black pipe insulation as the forehead brace. Now, other technologies such as 3D printers are also available in the shop.
Fabrication of specialized pieces, for example, that might be needed for ventilators or other medical components that could become in short supply.
Making sure doctors and nurses have the gear necessary in this pandemic battle.
Coronavirus testing is a concern across the country with a high demand but short supply. A research lab at Oregon State University is hopping on board, providing a critical preservative needed for testing. It comes out of OSU's Animal Diagnostic Lab. But don't worry, the chemical can be used to test both humans and animals for viruses. That's because it works as a preservative during the testing process, meaning after a swab sample is taken from a person, the preservative, known as VTM, keeps the sample intact until it can be tested at a lab.
You know, without this, their samples cannot be adequately preserved during transport.
Sanders says hospitals across Oregon and even the East Coast have asked OSU for the VTM. He says 3 liters can preserve about 1,000 tests. Sanders says there is high demand so far, but luckily, he says OSU can make a lot of the VTM. He says they can make around 20 liters of the chemical if needed.
Well, Mother Nature did it again across Western Oregon, giving us plenty of sunshine and those spring-like temperatures continuing. Here's a look at some of the numbers across our area, some of our biggest cities. Not necessarily record-breaking, of course, those are the numbers on the bottom row, but still, nonetheless, it was very nice and mild out there. Radar and satellite over the past several hours shows clearing conditions and nothing but blue skies and sunny conditions across our area on this Tuesday afternoon, but temperatures sliding back into the upper 30s tonight, still remaining clear, and the sunshine continues tomorrow, and that's going to lead way for a spectacular viewing opportunity tonight. It's the full pink supermoon, of course known for its color pink because it is the spring flowers that give it that name. I'll go ahead and talk more about our extended forecast in just a few minutes.
All right, Josh, sounds good. Can't wait to take a look. Well, on the South Coast, the Coquille Tribal Council is deciding this week to furlough a major portion of its staff in an effort to cut costs.
A lot of folks will be put to a furlough status, which will allow them to access their PTO banks, support for employees through our HR and executive team working with our employment division.
The Mill Casino and Hotel closed its doors March 18th. They were able to pay their employees salaries and health care the past 4 weeks. Meade says those furloughed would be able to return to work when the doors open again. There is also an impact on the dollars that go out to the community through the tribe's community grant fund, as it operates from a percentage of casino earnings. The Coronavirus Aid, Relief, and Economic Security Act, known as the CARE Act, was passed March 27th. NBC 16's Lauren Negretti reports on help coming for small business and other economic stimulus packages.
The $2 trillion CARES Act includes $350 billion in funding for small businesses in a paycheck protection program. Congressman Peter DeFazio says it's an unprecedented package to help keep small businesses going.
They are eligible for loans that will cover their payroll expenses, their rent and or mortgage, and their utility expenses, and these are totally forgivable loans.
Businesses that have laid off workers,
they can bring them back and pay their salaries
and still be reimbursed. Anyone laid off without a salary
will be eligible both for state unemployment and the enhanced federal employment, which is $600 on top of the state unemployment benefit, which varies according to what your salary level was That's a state issue.
And anyone previously ineligible for state unemployment is eligible for $600 a week from the federal government filed through the state. He says to check out the state's video explaining the form. Other relief packages being considered will include more funding for small businesses and others.
So we need more money to the hospitals, to community health centers, and other providers, and more money down to the communities.
Reporting in Coos County, I'm Lauren Negretti.
For the latest information on the coronavirus, make sure to visit our website, NBC16.com, our Facebook page at KMTR News, and download our app, KMTR News, on your mobile device. We have resources to keep you and your family safe and healthy. Well, coming up on your only local news at 5:30, pregnancy during the coronavirus pandemic could be a tough time for some. What experiences a soon-to-be mother and doctor have to share.